Well, I don't have a typical story like many do about always wanting to be a physician. I was born in Nigeria and I was raised in Nigeria. I grew up there. My mother was from Dayton, Ohio, and my father was from Nigeria. My mom was a nurse for about 32 years. My father worked for the country as a civil servant. I got some exposure to medicine when I came to the United States. In North Carolina when I worked as a transporter in a hospital and also as a physical therapist tech. I went to medical school at the Virginia College of Osteopathic Medicine and completed my medical training there, and then went off to Virginia Tech Carilion School of Medicine where I completed my neurosurgery residency training. I chose neurosurgery in particular because of my exposure to neurosciences when I was completing my master's in Miami. I chose medicine because I really think medicine chose me. I never had a desire to go into medicine. In fact, when I was younger, I always thought I'd be a fireman. And this is not normal, not your norm. I was a transporter in a hospital. I enjoyed working at Wendy's when I first came to the United States and McDonald's. I lived in Section 8 housing. I had food stamps, and it was a great experience and exposure to the United States. I enjoy hanging out with my family. I have 3 children and my beautiful wife. Besides that, I happen to be in school again, and I'm completing a PhD in public policy, hopefully within the year. Most of my time and my free time is taken up by writing papers. One of my commitments to patients and in medicine has been my passion for surgical and medical missions. I actually am a co-founder and president of the Cartatizo Foundation, which is a nonprofit organization. We not only provide surgical care, but also provide facilities for people to have and undertake free surgery. We also provide funding for people to undergo surgery with other local physicians, and we are also engaged in teaching local physicians. Perhaps the best situation and the most, I think, rewarding for me was a 2-year-old kid who interestingly had a shunt that was placed by another local neurosurgeon. Unfortunately, it had malfunctioned. Luckily, I was there and I had some extra shunts with me. So we were able to replace her shunt, and she's doing well too. Her mother sends me messages from time to time. I stay in touch with my patients in Nigeria. They have my contact information on WhatsApp. It is really a blessing and a unique opportunity to provide this type of care to these unique patients who are in desperate need for care. I'm not so sure you could write my story of my journey to becoming a neurosurgeon, but I think I'm privileged to be a neurosurgeon. I'm privileged to be a physician. I'm grateful for the opportunity to take care of these patients. One of the things that I think I do well at is actually managing patients in their darkest moment. We take care of trauma patients, patients with car accidents, head injuries, broken necks, spinal cord injuries. But I also have a subspecialty fellowship training in endovascular and cerebrovascular neurosurgery. So I get to manage patients who have brain aneurysms and patients who have other blood vessel problems of the neck and the brain. The job can be intense, but it's also rewarding when you can get a patient who is in a bad situation out of that problem and on the road to recovery. I enjoy that.